Well, we were promised the man in charge of health, and we have got him, Mark Charters. Welcome here, and of course, week 5 in the Isle of Man. How's it going?
It's going well. I'm getting around to meet all of the staff and all of the service areas. I'm trying to sort of assess the lay of the land, where we're doing well, where we're not doing so well, trying to also get as much as I can information from our service users and our customers.
Are you a bit of a troubleshooter? I mean, you know, there's been problems here, well, documented problems in the sense of a change of regime has been requested. Are you in here, are you the new broom?
Firstly, I don't believe any individual can be the broom. I think we need to do better. We can do better, and in any system, whether that be on the UK or any state across the world, any health and social care system can always do better. And yes, I'm here to do that. But it will be very much doing it with the staff, with the people of the Isle of Man, making our the outcomes for health and social care better than they are at the moment. And actually, that's a continuous improvement process. We'll always need to do better.
Well, the Minister's pinned you down very highly as the man for the job. In fact, you know, I was saying it does everything right on you in that sense, and you are going to be leading from the top. But you're not in the UK. Here, there's ministers that do get involved. Have you had that mindset yet, where it's slightly different? Because people have come in the past of jobs, and it hasn't worked out because they haven't been able to take full control.
Well, I grew up in New Zealand, and so I am familiar with island culture, and indeed not only familiar with it, I'm comfortable with it, and that's why I chose to come here. Another reason why I've chose to come and live and work on the Isle of Man is indeed the political structure that we have. I have a very good working relationship with the Minister. He is a principal politician, i.e. he wants to make a difference, and I want to help him to do that. In comparison with the UK structure, which you know, I think there's a view, particularly in health, that everything in the UK is somehow better than here. I can tell you it isn't, and it's failing in many ways. And part of that, in my view, is the political structure, where you have this massive gap between frontline delivery and the Minister, and therefore the ability to make decisions and change things. Here we don't have that. I work directly with the Minister. I want to work directly with my managers as well, so we can make those changes.
But by very nature, the old incumbent had all this in place, and they've been criticised heavily for how it went. It was entrenched, it was silo mentality, nobody talking to each other. You've heard the whole lot. You've come in here, you've got to get morale up as well. The troops have got to get to know you, you've got to know them. Is that happening already, or is it too early?
You know, I started my career as an assistant social worker in children's services, and I've worked every rung of that ladder. So I know every part of this business. And I know that as a practitioner, whether it be health or social care or housing, people on the front line come in to this work to do a good job. And that's exactly the case of all of our staff. There's no one that wants to do this kind of work just like a 9 to 5. So together, you know, it's my job to create a clear vision and a clear strategy, to pull in some of those managerial systems and to strengthen that. I mean, I'll accept, absolutely, we do need to strengthen those arrangements, and they've not been as strong as they need to be. But actually, with that established, that will enable frontline staff to work in an effective operating environment that enables them to practice in the way that they want to practice. So yes, that is my job.
Your last job has been in the councils in
Yes,
London, right?
yes.
But you have done health in the past?
Yes, I have, yes.
Have you seen the Isle of Man as a sort of nice retirement place to come to, wind down?
No.
To get back into this sort of job?
Not at all, no. It is. I came here because I wanted to be in a community. I wanted to work with customers or residents that are You know, I worked in the London Borough of Bexley, highly transient workforce, very difficult to get that kind of sense of community and engagement with local people. You have those characteristics here. It's a beautiful island. It's a lovely place to live, and I'm sure it'd be a lovely place to retire, but that's not my intention. My intention is to make sure that actually health and social care and housing services are as good as they can be on the island, and indeed that should be better than the UK. It should be a world leader, and that's what I intend to help.
A lot of hospital workers will be watching this because
Yes.
you know, this is their chance to see you. I know you're going around, but
Yes.
do they have that ability to knock on your door if something is worrying them? I mean,
absolutely.
You know, and will they not be seen as troublesome and be, you know, ticked off for it?
Absolutely not. Quite the opposite. That's where I started as a practitioner. Whether it's health, social care, whether you're a nurse, whether you're a social worker, a physio, occupational therapist, consultant, whatever you are part of that system. I need to be able to see all of that. I want to download that information as quickly as I can. I use the example with staff of when practicing in family therapy. When you have a troubled family, we had a room, and in that room, it was an oblong room, and in that room there was a mobile in the middle of the room, and depending on where you were, you saw a different aspect of that mobile, and part of the therapy was to go round the family and they put together their perspective of that mobile. I've found that description to be true of everything that we do. Actually, I need to know the total 360 of that mobile. I can only do that by collecting the perspectives of the staff in the business.
How did you find morale so far? Have you had that sort of feedback?
Everybody wants to do a good job. Lots of frustration in some areas at not being able to do that job. And I understand that frustration. And we need to work at making that environment better to enable, whether you're a nurse, whether you're a social worker, whether you're in the hospital, whether you're in the community, you know, it's important that we enable our frontline staff to do their job, and that's what I have to achieve.